Community health care workers, they're the backbone of the health sector.
Hodi hodi, habari za hapa.
Community health workers save lives. They're not doctors, just people who are your neighbors who receive training to provide basic primary health care door to door.
70% of the community health workers are women.
And for too long, it has been upon their unpaid labor that the health system has relied.
This is about dignity. When somebody works for less than they can live on, they've made a profound sacrifice for you.
How do you bring these voices together to be loud enough to be heard?
We are tired of working as volunteers.
We want to make sure that community health workers are salaried, supervised, supplied.
We need to change this conversation. We're going to make professional CHWs the norm worldwide, and we're going to use collective action to do that. Community Health Impact Coalition is a team in about 60 countries who've come together to make professional CHWs the norm. We mapped it out and we said, hey, what is holding this problem in place? Like, why aren't ministries making this switch to professional CHWs? We identified 3 levers. One was the research to create guidelines. So CHIC does research to equip international norm-setting agencies with the research to create professional CHW guidelines.
CHIC is assuring that we learn from each other about what works best.
When we go to WHO together, collectively, we were able to change WHO guidelines.
The second one was, how do we use advocacy to improve financing? Right now, the amount of money going to community health is incredibly fragmented.
There's no way we're going to do primary health care without community care workers.
So CHIC advocates to increase the amount of money that's going towards professional community health workers. And then the final piece was, it's not good enough that we create enabling conditions for ministries, guidelines, funding. There's got to be that demand. CHIC activates in-country networks to change national policy.
We speak like one voice.
We are advocating to be skilled, supervised, and salaried.
No, it's your right.
Nothing about us without us. We can say it from the bottom of our hearts.
Organized indigenous community health worker movement in every single country that's robust, that's led by community health workers from that place to trade notes, solve key problems, and bring that collective voice into policy.
I ask you to pay attention to us, recognize us, value us, and work with us, because we matter and our work matters. Being in a coalition gives a community health worker a sense of belonging for the first time ever.
This is the moment, actually, to be doubling down on this. We're going to make professional CHWs the norm worldwide. There will be a National Association of Community Health Workers in every single country, and there will be an International Council of Community Health Workers who can take this forward. There's more to be done, and the way that we get there is by staying together and staying in the fight long enough to win.